Our hospital bed setup has 3 inputs and outputs to introduce our students to. Now these are not set up to be functional. They don't provide any air or suction, but they do have the same setup as what you would see in a hospital room or other clinical setting. The yellow one on the side here that says MedVac, this is a suction setup. So this would be used to suction up fluids, either when treating a patient or in surgery or anything like that. You would connect a tube and then it would pull those fluids up. The second one is medical air. This would force air out of the system. You would set up a flow meter here and then go from there. This air is the same concentration as what we would find in everyday breathing air. Lastly, we have an oxygen port here. The oxygen port is 100% oxygen, and that would also be set up with a flow meter that would provide oxygen in a varying amount or a varying flow rate, but at 100% coming out of the wall. When we are using the outputs here to mimic different scenarios in our class, the ones that we typically use are the oxygen. So I'm going to apply a flow meter here. This is the flow meter, and this green part is called a tree. You are going to attach this in to where it belongs and then spin the white dial until it is tight. Once that is tight here, you would connect the oxygen delivery device of your choice to the tree by just pushing it on and making sure it's firmly attached. In real life, you would then adjust this dial until the little ball raises to whatever number you are looking for. And so I might choose a flow rate of, say, 6 if I was looking at using a certain different piece of equipment. There are 4 different delivery devices that we show students to deliver oxygen to a patient who is breathing independently. The first of those is a nasal cannula. A nasal cannula connects to the oxygen flow meter by a tubing to the tree. Okay? And then you apply these prongs into the nose. So we connect this around the ears, prongs go into the nose, and then we cinch up the bottom around our patient's chin there to hold it tightly in place. A nasal cannula typically has a flow rate of about 1 to 4, although some models will allow you to go higher, up to about 6 liters per minute. The second type of oxygen delivery device that we can use for somebody who is breathing independently is a standard or simple oxygen mask. Again, our oxygen tubing connects to the flow meter, although in this situation, our flow rate will be 6 to 10 liters per minute. And then we use the mask as intended by placing it over top of our patient's head, like so. Similar to a standard mask, we can use a pocket mask to deliver oxygen to a patient who is breathing. A pocket mask is useful because it is one of the only delivery devices you can use for someone who is and is not breathing independently. You take your pocket mask and then you open the clip on the bottom here. Your oxygen tubing connects to your pocket mask, making sure that it's sealed nice and tight. And then your oxygen tubing connects to the tree of the flow meter. A pocket mask or a standard CPR mask is used at a flow rate of 6 to 10 liters per minute, called a non-rebreather mask. A non-rebreather mask is connected again via the tubing to the flow meter. Typically we would close the gap here so that the bag fills up with oxygen, and then you would apply the mask over top of our patient's head and adjust it as needed. A non-rebreather mask is typically used with a flow rate of 11 to 14 liters per minute. There are two oxygen delivery devices that we use when we are delivering ventilations or breaths to a patient. So this is for a patient who is typically not breathing, but in some cases breathing really ineffectively. We might choose this as well. Option number one is a pocket mask. You'll recognize this from one of the options that we have when that patient is breathing independently, in which case they can wear it like this and access some oxygen. This can also be used to deliver ventilations or respirations by placing it over top of the casualty's face. And I'll just lift up the mannequin here so you can see it. We want this small piece to be over the nose and the thicker piece to be over the chin here. Importantly, this has to seal down. So if it is too low or too high and it can't seal on the face, the breaths will not go in. I connect this via my tubing to my flow meter, which is set at, again, 6 to 10 liters per minute. And then I can use that to assist in my breathing. So I will perform a head tilt chin lift, maintain that seal, and then breathe into my patient while delivering CPR or artificial respiration. The last oxygen delivery device that we talk about in medical studies is a bag valve mask, or what's commonly called a BVM. Now, BVM is used for patients who are not breathing or not breathing effectively in some cases, and it is not used for those who are breathing independently. A bag valve mask has several components to it. It has the mask and it has the bag in which we use. A bag valve mask is connected to our flow meter, but uses a flow rate of at least 14 or 15 liters per minute and can go higher than that. When we are delivering respirations or ventilations with our bag valve mask, this can be quite tricky. It's typically a two-person job because it's really hard to maintain the seal while also squeezing the bag. Now it's only me here in this video, so bear with me as I demonstrate it. This bag valve mask is placed over the face in the same way a pocket mask would be. So with the narrow piece at the top and the thicker piece at the bottom. And then you would create a seal here. Now you still need to maintain that head tilt, okay, in order to make sure the airway goes in. And then you squeeze this bag to provide ventilations. And you can see here that my chest is not rising. Oh, there we go. And so I want to make sure that I squeeze this bag nice and slow and controlled. We usually go a 1, 2, 3, 4, 5 before we go again, versus a, right, or really aggressive squeezing here. You'll also notice that we do have pediatric BVMs, which work the same way, except that they are designed for infants and really young children. And so it's the same setup, but a different patient.